Dr. Perry, what exactly is Tommy John surgery?
So Tommy John surgery is a surgery that we do on throwing athletes who have injured the stabilizing ligament on the inside of their elbow. And typically these are pitchers, baseball pitchers. It can be other throwing athletes too, but typically it's baseball pitchers. The most common way this happens is when the athlete has been throwing tens of thousands of baseballs over many years, and the ligament just fails as it gets stretched and stretched and stretched, and then just doesn't do its job anymore, and it's painful, and they lose velocity, they lose control, and they can't pitch. It hurts.
When you're doing the surgery, walk me through that. What is that surgery like?
Yeah, so we do the surgery two different ways. If the ligament is extremely damaged, we have to rebuild the ligament with a tendon graft, a piece of tendon from either somewhere else in the body or from a donor tissue to reconstruct the ligament. That's similar to ACL surgery. In cases where the ligament tissue is still reasonably strong and we're just dealing with slow failure, then there's another procedure very similar. It's called the internal brace procedure, where we reinforce the ligament. We make it stronger using man-made tissue instead of a tendon graft. And that's an easier surgery on the athlete, and it's also a quicker recovery. So that's a nice bonus.
You said we do this surgery here at Tri-State Orthopaedics. You did one this morning.
I did one this morning. I did.
On my way.
I did, yeah. So I had an athlete that I treated this morning, and I've been here for 32 years, and I've done hundreds of these surgeries on athletes in the tri-state community, and it's very rewarding. It's a long recovery, but it's very rewarding because you've got these typically young men, because softball doesn't tend to do the same thing, who they think they're done pitching, and they have the surgery, they go through the rugged recovery, and they get back up on the mound. I was just talking about a friend of mine in the medical community. Her son went through this, and she sent me a video of his first outing on the mound 9 months after his Tommy John surgery, and he's throwing hard, and she's crying that he's out there getting to pitch again. So
I think that shows the progress of the surgery, because years ago this would have been a season-ending, career-ending injury. How far has medicine come in this?
Yeah, so Tommy John, as you know, passed away this week, and his problem that he encountered pitching for the Dodgers happened in 1974, and a doctor by the name of Frank Jobe had the idea that, hey, we can rebuild this ligament. And so Tommy John allowed himself to undergo a procedure that had never been done before. There was no promise to him that he would ever return to pitching in the major leagues. And he went through the surgery, 1 year out of baseball, and he went on to pitch 12 more years in the major leagues, and he's one of the best pitchers of his era.
One of the questions that parents will probably ask you a lot is there anything an athlete can do to try to prevent this injury or not?
So the prevention is, to some degree, keeping the muscles of the arm strong, especially the shoulder muscles, because these things are all in some way connected. If the rotator cuff muscles are a little weak, the elbow will take more stress, and vice versa. The elbow muscles, the shoulder might take more stress. So there are specific exercises, and pitchers that come through good coaching, they know what those exercises are, so they need to be doing that, because young people tend to feel invincible. But you have to take care of your throwing arm. So that's one. And two is probably some people are a little more prone to this, but certainly people that throw too much in too intense of a window. So in other words, pitch counting, which has come into popular use, has really helped to some degree. On the other side, every 12-year-old can learn to throw a curveball now, because you can learn to do anything from watching YouTube video, right? And we used to not want those young athletes to do some of those things because of how it stresses their arm. And so maybe on the other side of this, even though we're doing some prevention and we're doing some exercises, we've got young people probably doing things a little before they should be, or before their bodies are capable of handling those things.
You said, Dr. Perry, that the injury happens in two ways. One, it's all at once, and one, there's a build up to it. Is there anything that a parent can look for in their athlete, some things that they're complaining about that could be early signs that this is something that may be on the horizon?
Yeah, pain on the inside of the elbow while pitching or at the end of pitching is something just to be taken seriously.
And do you just slow down play after that? I mean, is there anything?
Yeah, you have to rest. Yeah, you have to slow down, and that's the last thing that the athlete wants.
I'm going to ask you a question. It's always a heated question when you talk about athletes. Do you think early sports specialization is leading to a lot of these injuries?
Yes. Do I think it's going to change? No. But I do think that it was better for your body, even though these are young people that are quite phenomenal in their ability to do the sports that they do. I think it was better when they gave their body a break, when they stopped playing baseball and started playing basketball, or they stopped playing baseball and they wrestled, or any combination. I think going year-round at a young age on any particular activity puts you at risk for physical problems.
So what is your advice for parents?
Hopefully find other things that your child wants to do besides the same thing for 12 months of a year. I like golf.